Hi, and welcome to Triune Clinic. Did you know that every 40 seconds, someone in the world has a heart attack? Yes, it's one of the leading causes of death globally, but the good news is it's preventable. In today's episode, we explore heart attack, or what doctors call myocardial infarction. What causes it? How can you spot the early signs and protect yourself? Let's find out. To understand a heart attack, let's first see how the heart works. The heart is a powerful organ that pumps blood throughout your body, supplying oxygen to every cell. The myocardium, which is the muscular layer of the heart, is responsible for the pumping action of the heart. For the heart to stay alive and pump blood effectively, it needs oxygen-rich blood supply to itself. For that reason, the heart has its own set of blood vessels called coronary arteries, which delivers oxygen-rich blood to the myocardium and other parts of the heart. A heart attack occurs when one of these coronary arteries gets blocked, usually by a blood clot. This blockage causes damage or death to the heart muscle. It can lead to serious complications like heart failure or cardiac arrest. That's why a heart attack is a medical emergency needing urgent treatment. What causes a heart attack or increases your risk? In most cases, it's due to a blockage in the coronary arteries. This happens when plaque made of cholesterol, fat, and other substances builds up in the artery walls. This buildup, called atherosclerosis, causes the arteries to narrow. Over time, a plaque can rupture, triggering the formation of a blood clot. If this clot blocks the artery, oxygen cannot reach the myocardium, causing the cells of the heart to die, resulting in a heart attack. Risk factors include high blood pressure, high cholesterol, diabetes, obesity, smoking, lack of physical activity, and unhealthy diet high in fat and sugars. How do you know if you're having a heart attack? The most common symptom is chest pain, medically called angina, which feels like pressure, squeezing, tightness, or a crushing sensation in the chest. This pain may spread to the arms, neck, jaw, back, or upper abdomen. This pain might occur during activity or even at rest. It may come with shortness of breath, nausea, cold sweats, dizziness, or heart palpitations. Sometimes symptoms are mild or even silent, especially in women and people with diabetes. If you ever notice these signs, don't wait. Seek medical help immediately. To diagnose a heart attack, your doctor will ask about your symptoms and medical history. Then they'll run tests like blood tests to check for cardiac troponin, a marker of heart damage. Troponin is an enzyme released into the bloodstream during a heart attack. A significantly high level of it in the blood may indicate a heart attack. An electrocardiogram, ECG, may be done to detect abnormal rhythms. Imaging tests like echocardiogram, CT scan, or MRI help assess heart structure. And sometimes, a coronary angiography, also called cardiac catheterization, is performed to locate blockages in the coronary artery using contrast dye and X-ray imaging. Heart attacks are emergencies that require urgent care. The goal is to restore blood flow to the heart quickly. Treatment of heart attack requires medical and surgical interventions and, most importantly, lifestyle modification. Medical treatment may involve administration of oxygen, pain relief, blood thinners like aspirin, and medications to lower blood pressure and cholesterol. Nitroglycerin may be used to relax the arteries and improve blood flow and further relieve symptoms of chest pain. If medicine isn't enough, surgery may be needed. The common procedures are angioplasty and coronary artery bypass grafting. The choice depends on how severe and where the blockage is. Angioplasty is a minimally invasive procedure that helps to open up narrowed or blocked coronary arteries. Here, a thin, flexible tube called a catheter is inserted through a blood vessel in the groin or wrist and guided to the site of the blockage. A small balloon at the tip is then inflated to widen the artery, and in many cases, a tiny wire mesh tube called a stent is placed to keep the artery open. This helps restore normal blood flow to the heart, relieving symptoms and preventing further damage. Coronary artery bypass grafting is used for severe or multiple blockages. A healthy blood vessel from the leg, arm, or chest is used to bypass the blocked artery, creating a new path for oxygen-rich blood to reach the heart. The most efficient way to prevent heart attack is through lifestyle modification. Eat a balanced diet low in saturated fats, exercise regularly, keep your blood pressure, blood sugar, and cholesterol under control. Avoid smoking, manage your stress, and get regular health checkups. A heart attack strikes without warning, but with the right knowledge and lifestyle, it can be prevented. Protect your heart with healthy habits, stay informed, and act fast if symptoms arise. Thanks for watching Triune Clinic. Don't forget to like, comment, and subscribe for more life-saving health tips.